Thank you so much. So this is a paper which we have published in International Conference of Neurosurgeons in Zimbabwe, held at Congo, and the chief, I was the author of it, supported by Professor Kazadi. Kalango Kazadi is the principal chief neurosurgeon of Zimbabwe University, founder of neurosurgery in South African countries, and the Karthik Kopala, who is an orthopedic plastic surgeon who is supporting the stem cell therapy over here. Now, the question about spinal cord injury is two. There are many classification. Internationally, there are two classification. Is partial and what you call complete. So in this case, we will be speaking about the cervical cord injury, which is quadriplegic case, and how do you recover with the help of spinal cord injuries. Why brain mapping, rehabilitation, and spinal cord injuries are an important topic to be recovered and discovered and to understand. Very well, I will like to tell you to about your kind information. I have written a book on stem cell therapy, and I really enjoyed writing that book, knowing how it recovers the patient and how it supports the recovery of the patient. I'm very happy that we are all together to learn this topic, and definitely at the end of the day, we'll be understanding some critical things of the topic. So, spinal cord injuries are debilitating conditions and it impacts the mobility and independence of the patient. We understand that a spinal cord injury is one of the most difficult situations which we face in the clinic. Even if we take the class, there is every time road traffic accident and the fall injury. So, because of the fall injury and road traffic accident, we face and the age pathological fractures. Pathological means because of the osteoporotic fractures, we found that spinal cord injuries happen now and then. Whenever the cord is injured, it is injured in two areas. Uh, One is cervical, one is thoracic, one is lumbar. More likely, you will see the thoracic injury, which creates paraplegia, and if it is cervical cord injury, it creates tetraplegia. So we have written both the books, stem cell cord injury and how brain mapping helps in tetraplegia. That book has been written by me. Stem cell offers hope for individuals with spinal cord injuries by promoting nerve regeneration, improving the motor functions combined with intensive rehabilitation program. Stem cell therapy has the potential to significantly enhance recovery and improve the quality of life for the patients. So that is the most important part. It helps to the improvement of the quality of life. It gives a proper hope, proper recovery procedure. It is a reinnervation procedure, and it is a very good procedure for recovery of the patient. So spinal cord injury leads to partial or complete paralysis, impact the mobility and independence. This can drastically change person's life. Imagine you are today okay and tomorrow all of a sudden you become a spinal cord injury patient. You have no fault of yours. Suddenly a truck and lorry comes and injures you and you lose your cord. And then from a bed, an independent life to a wheelchair and life. And when there is no hope, stem cell therapy is an important hope of recovery to this type of patients. I've done large number of stem cell therapy, and we should really appreciate the fact that our own cells helps the it is a multipotent cells. Wherever it goes, it becomes that part, and then it recovers the part of that recovery, and it recovers the patient. Recording in progress. So one more thing I like to tell you, Mr. Chandrakant Pokar, who is our student from Kerala, has come today to with me and to study with me personally. And it was a very loving day, enjoying with him. And I'm very happy to teach him the different areas of brain stimulation. In fact, he's a very good, intelligent student. And I tell you, we have learned very good things together, discussion and knowledge. So whenever you have a spinal cord injury, you have a sensory loss and functional loss. So the sensory loss is causing numbness, tingling, and loss of sensation. This can impact everyday life, making it difficult to receive temperature, pain, and touch. So whenever there are two types of deficit, what are they? Motor and sensory deficit. So in spinal cord injury, you enjoy both the deficits. What are the deficits do you enjoy? There is no sensation and no motor control. And then there is the bowel and bladder control difficulty, respiratory function difficulty, sexual health, and quality of life. So when you are totally bedridden, because in cervical cord injury or thoracic injury, you become totally bedridden. My speed is okay. Dr. Liu, my speed is okay? Is comfortable with you or am I speaking too fast?
Yes, sir. No problem, sir.
Dr. Liu?
No
Or I
It's
should
problem,
okay.
speak
sir.
Not too
little
fast.
slow?
Not too
Or
fast.
I should speak, I'm too fast, right? Okay,
Yeah,
I'll
it's
try to
okay.
be
It's
little,
okay.
I'll try to be little slow. Because in India,
Mhm.
we have a habit of speaking fast because we have to complete a wide syllabus in small time.
Mm.
So, so whenever we speak about spinal cord injury, it's a spinal cord is a connection and extension of the brain. So it gives a musculoskeletal control of the muscles. So it's a delivery system from the brain to the nerve to the muscle. So whenever there is a transaction injury, means the breaking of the cord because of injury, which is accidental or fall injury, what will happen? You lose motor control and functional control. Then there is incontinence of bowel and bladder. So far, we have been able to achieve so many good results. Stages of recovery. Yeah, the most important part we see is the limitations we rely on physiotherapy and occupational therapy because there is no signal interpretation from the damaged area to the brain, no re-innervations, uh, no communications, no recovery of the cord. Uh, so we teach them assisted therapy. Assisted means wheelchair assistance. We teach them how to live, how to mobilize with the wheelchair. We teach up to that much. But so far, if we see, can a patient walk? That is the most important topic we have to discuss today. And you will see a lady, girl of 15 years, who had a spinal cord injury with fixation and myelomyelitic changes with myelopathy. She is able to walk. She came in quadriplegic stage and she is able to walk. So medications are used to control muscle spasm, pain, and prevent secondary damages. So all these people, they have what? Secondary damages, respiratory damage, continence, infection, because they are on Foley's catheter, right? So this Foley's catheter may kill. Please excuse me. Okay, no, the phone is correct. So they have significant side effects which can limit the long line overall effectiveness. Further, they may have bed sore. So all these things they may develop in a gradual period of time, especially the weakness of the core muscles, the abdominal muscles, uh, the lifelong wasting of muscles, the dependence on osteoarthritis both in the hip joint or in the knee joint. You develop all these significant steps in a spinal cord injury patient because his activities are not there. So physiotherapy is assisted therapy, but can it recover a spinal cord therapy injury? We have the answers are not very clear to us at this moment. It definitely helps, but how far it helps, we have a limitations of it. Definitely every subject, even a neurosurgery and spine surgery has a limitations. They have a spine fixation, but they don't have the capability to make the patient walk on this status. Am I clear to all of you?
Yes, sir.
Dr. Liu, am I clear to you?
Yes, sir.
Am I clear to you, Dr. Liu, so far?
Yeah, yes,
Yes, doctor.
yes.
Yes.
Yes, sir. Thank you so much. Surgery sometimes used to stabilize the spine. So most of the cases we opt for spinal cord surgeries. It is called fixation. So we fix the pedicle screws with the interconnecting rods to stabilize the spine so that further injury does not take place. But the spinal cord injury does not mean the recovery of the patient, right? It does not anywhere signify that the patient will recover. So, uh, so out of one, two things in this slide, we can confirm that occupational therapy, physiotherapy helps in assistive devices, but the aim to improve the mobility and independence, but they lack the ability to regenerate and damage the nerve tissue or restore the lost function. So, so what is our abilities to restore the lost functions? So these are functional rehabilitation. So in functional rehabilitation, whether it is spinal cord injury, whether it is paralysis, whether it is brain stroke, whether it is neuropathy, everywhere we have one common topic. What is the common topic we face? Functional recovery. We face a common topic of functional recovery. Can my hand move? Can I walk? Can I stand? Can I drive? Can I do life like before? So even if you see the Mayo Clinic, they have not come up to now with the evidences and witnesses that they can recover a spinal cord injury to this level. We are very happy to say that to a great extent it helps. But in how many cases it helps, what cases it helps, is still a question mark. But in spinal cord injury, paralysis, and myelopathy definitely helps. Traditional treatment for spinal cord injuries like medical physiotherapy often fall short in rest function. They can help them manage the pain and improve some mobility, but they lack the potential to regenerate full functions. Stem cell therapy, a new approach for so these are multipotent cells. Stem cells are multipotent cells, and they are taken from your own bone marrow, and then they are regenerated, either the blood or the bone marrow, and they are re-injected in the injured site, right? Not going near the cord, so that there is no meningitis. They don't go near the CSF fluid. So they are injected near the facets and other areas, and then you see gradually it improves the spinal cord because these cells are multipotent. Whichever area they go, they'll become like that. For example, I go to Singapore and I become a Chinese. But when I come to India, I become an Indian. When I go to Malaysia, I become a Muslim, right? So this is a quality of what? Stem cell therapy. Wherever it goes, it regenerates. If it goes to cardiac muscles, it becomes a cardiac cell therapy. When it becomes to stem cell, it goes to spinal cord, it becomes a spinal cord therapy. So the persons need intensive rehabilitations. Uh, Other things has to be done so that the neuroplasticity and relearning of motor skills, strengthening of muscles can be improved. So it is not only the stem cell therapy, the neuroacupuncture, the brain mapping, the brain stimulations, and everything helps you to recover a functional recovery of the patient. The groundbreaking study involves 30. We have done a groundbreaking study on 30 students for this research paper. These patients were carefully selected based on their injury characteristics, functional status, and willingness to participate in rigorous rehabilitation program. The study design focus on evaluation and combining efficacy of stem cell therapy and intensive rehabilitative function recovery. So in here, we have collected 30 patients on whom we made this study. These patients were included those who had cervical cord injury with transaction injury, both in cervical and dorsal. So this study was made by self-funded study, and it was made on 30 patients. So I'm presenting you a proper case study, which we have given on 30 patients, right? And the injury level was cervical and dorsal. Bone marrow derived mesenchymal cells, MSC cells, were harvested from healthy donors. So here the donor itself is the patient. We don't use the donor of uh, X to Mr. Y and Y to Mr. X. We take harvest the bone marrow cells from the patient party itself, and then the cells were cultured in a laboratory setting where they are expanded, purified to ensure a high concentration of viable cells. The step ensured that the cells were of high quality and capable of performing their regenerative functions. So, under a controlled mechanism and aseptic procedures, this procedure was done. No infection was found in all the 30 patients. We have done large number of cases, but we are just presenting a pilot study of 30 patients. And these cells are called mesomerical cells, that is MSC cells, and they were cultured. More than culture, centrifuge was used, and then we injected the patient. No infection, no unwanted thing was found up to this level. The program emphasized targets exercise, including strength training, balance training, gait training. Patients participate in a variety of exercises such as treadmill, walking, cycling, and upper exercises. So we allow the patient to participate in all this. Focus was placed on incorporating activities of daily living such as dressing, bathing, eating to promote functional independence. Patients were encouraged to perform the tasks that they struggle with before the injury, gradually increasing their ability to participate in daily life. So here they were taught how to participate in their daily life, how to become independent. Occupational therapy, we have used a different way. We have included them how to work with assistive devices, and then we have taught them how to do what you called use PS5 for all these techniques, and how to become independent every day. That was taught of our mind. So we found that this is very important aspects that stem cell therapy develops in a person. And cognitive and psychological support. The most difficult part of a spinal cord injury patient is depression, anxiety, neurosis, psychotic cases. They become too many psychiatric psychiatric indications are developed in this type of patients because excuse me, psychiatric implications are developed because you see a patient who is independent today and becomes dependent today. For example, I am walking so nicely, and after 1 hour, my spinal cord is broken and I become dependent. What will be my status of life? How will I think? I will become to the depressed level. The psychological support, cognitive support, all this has to be given to the patient to increase his mobility level, to improve his psychological status. So, whenever we are speaking about stem cell therapy, it is not just about the stem cell therapy, it is aggressive rehabilitation, um, spastic development, utility of the Botox and other medications. So everything has to be used in a proper way to recover the patient. Just thinking only stem cell therapy will recover a patient, it is not the question of the recovery. A patient needs proper support to recover from the spinal cord cases. Am I clear?
Yes.
So here you will see, this is a patient of spinal cord injury. Here you can see, this is a quadriplegia patient. She was a girl of 19 years. Here you can see this surgical area, fixation and enlarged case. Can you see that in the X-ray?
Mm.
Dr. Liu, can you see this?
Yes.
Can you see my cursor?
Can. Yeah.
Not very visible, sir.
Okay, I'll try to.
Mm.
This. Can you see?
Yes.
Yes,
Mm.
sir.
Yes. Yes.
Yes,
Can you
sir.
see now?
Yes, sir.
Yes.
Thank you.
This and
Here.
this. So can you see it very clearly?
Yes.
Yes, sir.
So it is a cervical cord injury. In this case, the patient becomes quadriplegic. Quadriplegic means both upper and lower limb function is lost. And now you can see the patient is walking. So this case was referred to be
Mm.
one of my student, Dr. Sunil Yadav from Mumbai, and they have been treated in a very good hospital in Mumbai. She was admitted, she was operated, And then she was brought here for further recovery and management. So you can see how we have done. Can you hear the voice of the video
No, sir.
now?
No, sir.
No, sir.
Yes? Can you hear the voice?
No, sir. No.
No.
Not at all?
No,
No, not at all.
No at all.
No, no, sir.
Mm.
no, sir.
You can see there is no movement, totally no movement.
Mm.
This is a tetraplegia patient, quadriplegia. She cannot able. She is totally bedridden. She is not able to sit, not able. Now you can see after the treatment. There is no braces, nothing. So you have seen this patient was totally tetraplegia, and we made this tailored video in 1 minute, in which you have seen the patient was unable to move, unable to walk, totally bedridden, and now you can see the same patient walking with one finger support. This is called the functional recovery of the patient. Am I clear to you?
Yes, sir.
Yes.
In how many days, sir?
Yes, sir.
This is called
Sir, how many days, sir? Treating?
functional recovery, right? So when we monitor these patients, right? The neurological has evaluated the motor strength, sensation, and reflexes. Functional tests measured the mobility, balance, and coordination, and patient self-reporting. Gathered subjective experience and functional indications. So what was the level of assessment? This was our neurological assessment, the functional test, and patient self-reporting. How much he has improved. This was our monitoring the neuro monitoring of the functional recovery. So this was a facets which we have gone through the recovery of the patients. So this was after the stem cell was put up to the patient and the 50-day follow-up period. The data collected provided a comprehensive picture of the patient's functional improvements and allowed for a detailed evaluation of the treatment efficacy. So we have taken it after the 50 days. Remarkable results were obtained in more than 20 patients. So achieved more than 50% of the motor recovery in 20% of the patients after 15 days of the within 50 days of the treatment. Did you understand? We have remarkable results were achieved of 50% patients, right? That the stem cell therapy combined with intensive rehabilitation and improving motor functions in individuals with cervical and dorsal cord spinal injuries, they recover. So patients who underwent the stem cell therapy and rehabilitation programs saw remarkable progresses. They transitioned from being wheelchair bound to the needing support for walking. The use of walking or crutches allowed for increased mobility and sense of independence. So we gave them paraplegic walker. Initially to this girl also we gave paraplegic walker, but gradually if you see the quadricep and other strength revived to such an extent that she is able to walk independently, and now she is able to achieve functional recovery. Supported walking was a significant milestone in the recovery journey. It is significant improvement of muscle strength, balance, and coordination. This achievement represented a return to functional activities and improved the quality of the life of the patients. So now you can see what were the three things we gained. One was independence progress, one is functional gain, and what is motivation and hope. Now these patients who were totally demotivated, devastated, destroyed their hope, and when this girl also came, she was so hopeless. She was feeling what will happen to her life. She was only crying when I saw her. For 15 days, we took a lot of difficulty to make her believe that she will be able to walk. Whereas she was saying, I'm not able to sit, forget about walking. So a patient who comes totally from a bedridden stage to the walking stage is a significant development which we can see, and it's a hope for the future generation that brain memory, stimulation, nerve stimulation, resortations, core resortation is a very improvement fact of recovery, whether it's a hemiplegia, quadriplegia, tetraplegia, a neuropathy, or any other nerve injury or muscle injury, neuromuscular disorders. Really, I tell you, whether it is myotonia or anything, patients attend a significant. So emotional independence. So here what we have done in our clinic, we have created a community type. All the patients are brought from the room and they are put in one all together. They speak to each other, they support each other, they give moral comfort, and they support each other, right? So that is very important. Social integration, social support, moral support,
Mm.
cognitive support, and social participation, and making a patient independent so that he can live his life. Imagine a patient at this age, and for next 20 years, can you believe that the patient can live a very good life on wheelchair? What will happen if that parents become older and she remains like this? What if she gains a weight because she's not mobile, and if she gains a weight of 30 kgs or 40 kgs, which becomes 70 kgs or 80 kgs sitting on wheelchair? Can you believe that recovery will happen in this type of patient? It becomes a very, what you call, a very critical object and subjective issue that whether these things can happen if the weight gain is there. So much things are there. Further, the nerve denervation, that loss of cells, the loss of things happening inside the spinal cord, the communication lost, and everything which happens inside the spinal cord and the brain, the nerve damage, the brain damage, the loss of command between the brain and the muscles, all these things have to be regained, whether it is stroke induced paralysis or spinal cord injury. All these things require a systematic and programmatic approach. And that is what I was saying you. Thinking on one direction will never recover a patient, but making and thinking of all direction in all way will recover the patient. The stem cell therapy of spinal cord leverages the remarkable regenerative properties of the stem cells. So you can say what is a stem cells? So it differentiated into multiple tissues. It is like a one tissue. If it goes to the joints, it becomes a part of the uh, since it is a multipotent cells, it becomes the part of the synovial fluid. When it goes to the nerve, it becomes a part of the nerve. When it goes to the bone, it becomes a part of the bone. When it becomes to the organ, it becomes part of the organ. When it goes to the cartilage, it becomes a part of the cartilage. And it regulates the immune system and self-replicate. A mother cell becomes a auto regeneration process takes place. The stem cells can be sourced from the bone marrow and umbilical cord or other tissues. So there are various places, but we believe that the stem cell which is derived from the bone marrow is the best process. When injured into injury site, these cells have the potential to replace damaged cells, promote neural regeneration, reduce inflammation. This process can lead to improve motor function, sensory inventory, and ultimately improving the quality of life for individuals with spinal cord injury. So this is what we are saying, that it leverages the reinnervation of the nerve, develop the cells, and you can see the most important part when we see from the bone marrow stem cells is the development of the T cells, the leukocytes. It helps in cancer, it helps in erythrocytes, the red blood cells, the platelets. It helps everywhere. So the bone marrow taken out is a factory of such cells from where you take out 10 ml, you process and you inject, and I tell you, it's a lifelong gift to the patient. I always say it is an anti-aging process and it is a lifelong gift to the patient. Now, if you want to give something gift to a patient or anyone, what will you like to give? Something lifelong gift. And bone marrow stem cells are lifelong gift to a patient. It's an anti-aging process, it's a regenerative process, it's a recovery process. And I tell you, down the line in 5 years, no one can stop stem cell therapy. Even the government cannot stop. It will become so demanding because of its recovery nature. The cost will tremendously come down. We are doing it at a very low cost price. So it depends on us how much we can. Great. And most important part is it reduces the the complex interplay of factors, including inflammation, growth factors, cell to cell interaction. This activates what? Cells then begin proliferate to migrate towards the injury site and then they contribute to tissue repair and regeneration. This process involves a cassette of molecular events that promote the survival, differentiation, and integration of cell damage into damaged spinal cord. So this is what we have seen. It repairs the damaged spinal cord. Stem cell can release the growth factor that stimulate the growth of the new axons, long extension of neurons that transmit signals. This can help bridge the gap created by spinal cord injury and restores the communication between the brain and the. So it promotes the action growth, enhancing the synaptic connectivity. So overall, the neuroplasticity takes place. This is what is the goal. That whatever was lost is now regenerated. So what else we require? We don't require a lot of chemicals to recover. The body, whatever is lost, has been regained. And this regaining is very important in stem cell therapy. Stem cell therapy is a very beautiful subject in which you can see आपका सेल्स आप ही को इलाज करता है एंड देन इस तरह से इलाज करता है कि आप वापस रिकवर होते हैं. So the problem with us is that we don't want to recover the patient. The problem is we have closed the chapters, we have closed the books, we only say put physiotherapy. We don't want to take any extra milestone to recover the patient. If the patient is recovered by 50%, we think rest of the recovery can be done at home, rest of the things can be done. But the biggest problem what we are facing in our clinic is the self advances taken by the patient. So clinical counseling, referring the patient while counseling is most important part. Always remember as a physician, we are the guardian of the patients. If you can able to counsel the patient in the proper way, you will give a new life to the patient. Money is secondary. The life of a person is important. Imagine large number of people are on the street. Only one comes to your clinic. That's fine. But if he gets a good life, good support, good recovery status, what else we require? Am I clear?
Yes,
Yes.
sir.
Yes, sir.
So now
Yes,
whenever
sir.
you see
Yes, sir.
osteoarthritis, uh, hip joint arthritis, shoulder arthritis, right? Various yesterday we were speaking about physical atrophy in the spinal cord. There are large of inflammatory sites we have inside. Now, but uh, so these cells have anti-inflammatory molecules helping to minimize this tissue damage and promote healing. The most important thing, we don't have something which is identical to stem cells in this market. We have no chemicals, we have no medicines, we have nothing which is identical to stem cells. And it is a easy procedure, less invasive, minimal cost, and high potential. So that is why I say when I speak about spinal cord injury, it's a very good procedure, very good recovery, and it has a capacity to fight with hyperactivity, CP children, and it promotes a very beautiful recovery. And the most important part is extent to the reducing of the formation of the scar tissue, which impedes the nerve regeneration. Stem cells can either replace or inhibit the formation of scar formation cells, creating more favorable environment for the nerve repair. So there is a scar in the cord, there is a scar in the surgery site, there is a scar on the nerve, right? So these stem cells, they have what? Anti-inflammatory properties. They can either replace or inhibit the formation of scar formation cells. So whatever scar has been formed, they have the capacity to improve. And it improves the nerve regeneration. So minimizing the inflammation, scar tissue stem cells create a more conductive environment for nerve fibers to regenerate and reconnect, facilitating the recovery of motor functions and sensory perception. So it is promoting neuroplasticity. Intensive rehabilitation plays a crucial role in promoting neuroplasticity, the brain's ability to reorganize itself from a new connection. It helps the neurons to system them adapt to the injury and compensate for the lost functions. 1 minute, please. Hello. Hello.
Yeah.
The rehabilitation progress is tailored to each patient in such a result, targeting exercises, physical therapy, occupational therapy, everything is required. But on the other hand, I have seen the importance of Mayor's cocktail, good nutrition, gut therapy, and then the PRP therapy is guided by NCV EMG test. It brings optimal recovery. We cannot say that everyone will recover at a very high level. Even in this case, 50% of the patients out of 50, 30 has obtained very good recovery, over 50%, 10 has obtained 40%, and less 10 in 5, they obtained good recovery, 5 were confused recovery. Because these 5 patients did not took regular treatment, they opted out, they had financial problems, they just decided of their own, and that is why the recovery was slow in this type of patients. Intensive rehabilitation plays a crucial role in maximizing the recovery after stem cell by engaging in tailored exercise, therapies, medications, other things. You plays an important role in contribution with what you call specialized training with promoting muscle strength, balance, coordination, and motor skills. All are contributing to improve the mobility and independence. So, only stem cell therapy is not the source of recovery. Neurostimulation, nerve stimulations, spinal cord stimulation, stimulating near the spinal cord with extensive procedures, what you called vagus nerve stimulations and other nerve stimulation, brain mapping, brain stimulations, rehabilitative process uh, will make the patient gradually independent. Relearning, learning, and relearning is the only process by which neuroplasticity can take place. And once the neuroplasticity takes place, the recovery of the patient is beautiful, terrific, and you can see from a wheelchair to a independent life. We have witnessed a girl who was totally wheelchair bound is walking today without support, with one finger support. What else will we require? This is the result which we are speaking of. We have already spoken about this. So the most important part, longitudinal outcomes we should think of improving the plateau of reaching the recovery from potential, fine motor skills, combination to continue refine, allowing for more complex tasks. So it is more important that now the patient should be able to perform more complex tasks. Sustained improvements are observed. Patients maintain their gains and adapt to their new lifestyle, enjoying an increased quality of life. The most important part, first, second, and third, is the last part is that within a 1 year plus, the patient starts enjoying a very good life. From a wheelchair, bedridden, where he was not able to sit independently. From there, you see the patient is doing dumbbells, walking without support, improving. And when these neural connections are built up, they should be allowed to be built up. But what we do, we don't allow it to build up completely. And then after achieving a certain recovery, when the optimum results are gained, we don't allow these optimum things to happen. And when we don't allow these optimum things to happen, the recovery becomes at the backdrop level. Back means it rebounds back. So this is most important part we have to understand. So sustained progress is there, longitudinal monitoring is required, continued rehabilitation is required. So it is not like 1 day case or 2 day case. So this is what I have said. And the most important part is overcoming the wide ongoing research and clinical trials are there. Longitudinal studies have to be made. Exploring new stem cell sources are also important. Researches are going on, but to our best level, we found the bone marrow stem cell is very good. It improves, it gives sustainable results, and it gives recovery to a very good level. Because these are Mesenchymal cells, MSC cells, it has multipodent cells. Wherever it goes, a clone of this cell is developed, the inflammation is reduced, the connectivity is restored, functional recovery can be achieved. And it is not only in this, if you see Dr. H.L. Dwivedi was a pioneer of kidney stem cell therapy in India, has discharged patient with kidney transplant with zero rejection rate. Is no more, but he has passed. He has a large number of kidney transplant surgeries with stem cell therapy, and there was zero rejection rate, and he did a most wonderful task. And I really thank that I got an opportunity to study his work after his death, and he was my greatest inspirator. Dr. I.P. Cherian was my greatest inspirator, who inspired me to write a book and to enable me to write those chapters which are still missing in our books, that yes, these things are possible. Where we see there is something called impossible, we say that yes, I am possible. And this is what my things are there. This is possible in Parkinson's, stroke-induced multiple sclerosis, amyotrophic sclerosis, Parkinson's disease. So the broader impact can be seen in diabetes, type 2 diabetes, and everywhere you can see the help of this type of diseases. And the expertise, expanding research, and diverse perspectives are required to obtain an optimum result. The patient should be very much. Uh, the most important part plays here is the referral physician. How you refer the physician, how you refer it. आप किस तरह से उसको समझाते हैं, किस तरह से गाइड करते हैं, स्टेम सेल थेरेपी के बारे में कैसे समझाते हैं. Lowering down the expectation एंड हायर द मोटिवेशन. जब तक आपका मोटिवेशन अच्छा नहीं है, आपका काम करने का तरीका अच्छा नहीं है, until you expand your ability, until you guide the patient to motivate, to revive, to recover, nothing can happen. So it is always says the primary role is always with your hand. The primary role is yours. The recovery role is yours. And I'm very sure one day you will be in a position to recover large number of spinal cord injuries. The legacy is in your hand. The knowledge is in your hand. The stimulators are in your hand. And that is why I said whatever I speak is from the table. I don't speak from the book. There in India, we call it Jugaad technology. We cannot buy RTMS and ligation transmagnetic stimulations because of their cost. But we have made our own ability to what? To comprehensive the maps, to comprehensive the procedure to bring the functional outcomes. You see what kind of people are there. So this is what we need to understand, that a spinal cord injury patient care, why it is called advanced regenerative research and regenerative medicine. Regenerative medicines, it really helps the patient to recover. And the stem cell scientists are actively investigating the ways to enhance the efficacy and safety of this treatment. This includes developing new techniques for stem cell therapy, manipulation to achieve the optimum human therapy. So it is engineering and in participants, physical support, social work, all this is required. And most important part, it is a frontier, a promising new frontier for spinal cord injury patients. A patient who is bedridden, who is totally bedridden, who is not able to tilt right side, left side, upside, who is not able to walk from there to this research activity, and faster the things take place, we lose the cells of the spinal cord. Every moment we lose the cells of the nerve. Every moment we lose the cells of the brain. The moment we become aware and we try to preserve and reserve and then we optimize the results, the patient life is improved. That is why we say everything is required. It is not just like ordering a matar paneer or Indian one dish item. It is entering, entering, ordering a buffet. You need a buffet, a continuous item after item you have to introduce. It's not one single system which will recover system. Just putting a stem cell therapy, a patient will recover. The idea of telling you this was that the thing what you are saying, I am impossible. and it is impossible to recover. If you divert this word into three words, impossible becomes says I am possible. The only meaning of the creating this class to you was saying that whatever you think is impossible, the impossible says I am possible. Now it is up to you which from which part of your eye you see. It is I am possible or impossible. It's all your nature of looking on the patient.
Nothing is impossible.
That
Mm.
what do you think in your eyes? What is the thought comes to you? The thought which develops you only will create a good action. And this good action can develop a good activity in your life. This is what I say. That never give up. Never thought of giving up. Anyone can be negative in your life, but you don't be negative. Every factor, every patient will be a demotivator to you. Even your students are the greatest demotivator to you. All people will be against you, but you don't be demotivated. You go your way, you find your way, and one day I tell you, we shall overcome, we shall overcome one day. Oh, deep in my heart, I do believe that spinal cord injury will recover one day.
Kami
So with this, uh,
Mm.
we stop the sharing, and I always say, we shall overcome one day. मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. Oh, deep in my heart,
Mm.
I do believe that we shall overcome one day. We shall walk together. We shall walk together one day. Oh, joining our hands. I do believe that the faith in my says thee. Right?
Yes.
Thank
I
you,
call my
sir.
voice as a fata bass, a broken bamboo, the most hated singer in my life. I see myself, but still I did not stop singing. Because this singing gives me a new hope against all negative circumstances. When the patient comes highly negative, parents are negative, students are negative, everyone is negative in my atmosphere. The physiotherapist, the orthopedic surgeon, the neurosurgeon, everyone is saying negative, 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 negative.
Mm.
From morning to night, you only see one thing. What you know? Not possible. Impossible. And I sit in my chair and I do like this always.
Nothing is
And then
impossible.
and I always say one word. Impossible says I am possible. It's up to us. We see it impossible, or I see it I am possible. Right? That is why I say we shall overcome one day. Stem cells will come, neurostimulations will come. No one can prevent from neuroacupuncture to come up in the market. No one can invoke the brain stimulations. So before 10 years
Mm.
when we were speaking about NIBS, RTMS and all, people were laughing at us. What is RTMS? How course will improve? But today, everyone is using PRP, RTMS, they are coming up. Now they have gone one step ahead. We have gone to live navigation transmagnetic stimulations. So all these things are coming up. But the only problem is we are not coming up. The world is going ahead. The moving ahead. We are going towards 22nd century. We are going towards 7G and 8G, and still we are speaking about 2G. And that is why you say GG, I speak about 7G. Huh? So by 2025, we are having 7G. The speed communication is very high. We'll have better communications, better Zoom classes, better speed, better
Mm.
technologies. And today we are speaking about 4G, 5G, 2G. Still, we are speaking about 2G. When spinal cord injury comes, we speak about 2G. But when we speak about uh, Mobile, we speak about 6G. Imagine, where is our thought? In mobile, we want 6G. In spinal cord, we want 2G. So, and sometimes I say, even you don't want 2G, you want 1G. G. In India, we have less called GG, right? G, 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 G. Means okay, 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 okay. Yes. We say G, 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 sir, G, sir, G, sir, G, sir. Okay, 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 okay. You are right, you are right, right. But then right always says you are wrong. So when we say you are right, we continuously shake our neck like this, down. It means you understand.
Yeah.
I am taking my thought from here. I am pushing you back. You are saying me no. So I said, okay. So you push it here, and I put my chin down, cheek down, and the thought bounces back to you. No, I don't accept it. So that is why I say, okay, Charlie, thank you so much. People don't understand what is Charlie. So when people say me too much negative, I say them Charlie. You know who's Charlie? Can anyone say who's the Charlie here?
Mm.
Yeah? Charlie Chaplin. So anyone who says the patient cannot recover a negative thing, I always say, okay, Charlie, things will happen. So all those who have closed this webcam, their attendance is cancelled. Only 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 people's attendance has been recovered. Others all are cancelled because I don't know who is doing what. Now opening is of no use. I told you to open the cam before. You may be dancing in the room. You may be sleeping in the room. What I know? Coming and going, like me sometimes. I close the mic, this one, and I keep eating. Who knows what you are doing? And you should put picture like Muhammad Arsad. It's just a very genuine picture. If you see his picture, it's just like a live telecast picture, right? You just put this picture. So if you see from distance, it's just like he's opening his cave. But closely, if you see, Arsad Sahib is not moving any hand, leg, eyes. So you understand
Mm.
his webcam is closed. So that is called proxy setting. It's called
Yes.
proxy bunker.
Sir, I am there.
That's a song. It is called bunker.
So happy.
Since I'm a university professor, I always use a very beautiful word called bunkers. Always I say, you last bench bunkers.
Yeah.
So those who
In,
want to stay in the class, they stay. Those who want to go, they go. In
in
India, we
India,
call
say
आओ to welcome. If you come, welcome. If you don't come, bhid come. Means the crowd is less. Come, welcome. Don't come, bhid come. Bhid come means no, the crowd is less. So it's up to you. You want to participate or you don't want to participate. There is only two things: participate and no participation. And learn from Muhammad Arsad. Very nice thing. Put two, three pictures which looks like the live telecast pictures and put it on the what you call and don't and it looks he's giving a full attendance in the class as if he's on the live on the
Mm.
webcam. So when you open his notice, he will just move his head. Then again, this is the power of technology. Right? So Arsad Saab is a very good subject of spinal cord injury recovery, right? स्टेम सेल डालो तो रिकवर करेगा नहीं अरशद साहब को कुछ बोलेगा तो मूवमेंट करके
No, no,
दिखाएगा
yes, sir.
नहीं तो वो तो फिक्स
Okay,
पिक्चर
sir.
है अरशद साहब आई एम जस्ट जोकिंग मेरी आदत है आप बुरा मत ना ले किसी हिसाब से इसको कोई बुरी मैं बस मजाक करते रहता हूँ डोंट टेक इट अदरवाइज everything should be what when you have a high boosting classes after the class the temperature should go low. So you may ask me the question. I put myself to the panel. for asking your question and answers. मैं अपने आप को पैनल के पास भेजता हूँ. You can ask your question and answers to me. Please ask your question and answers. I hope the class was interesting.
Yes.
See, there are a lot of things to
Yes, sir.
speak, but then speaking will not help you, right? बोलने के लिए तो रामायण है. I have so much epics to speak, but we have to conclude our speaking in limited time, right? Because after 15-20 minutes, you have to go to your bed. Liu is already overtime. He's in Singapore, so or Malaysia is already overtime. I have to send him after 15 minutes. Otherwise, he will give me, he will throw shoes from there. He will throw shoes from his country, and I have to open a shoe shop. So, we have another 15 minutes. You may ask me a question and answers, please. आपके पास 15 मिनट है. आपको जो पूछना है पूछे. Whatever questions you want to ask me, please ask.
Sir, hello.
हाँ माधव राव जी, please, Dr. Madhav Rao, please tell me. Please.
Sir, stem cells can be injected orally.
No, stem cells cannot be injected orally.
Some old peoples were saving placenta and
No. All this, to my study and my research is autologous stem cells which we are taken from bone marrow.
okay.
After taking CBC, complete blood count, and the hemoglobin level is good, it should be always taken out from the bone marrow stem cell. It is less invasive.
Okay, sir.
Very easy to
Sir,
process.
what is the
Let me complete one thing. It is very easy to process, very easy to inject, and no carcinogenic, no post-operative infection, and only 2 antibiotics are enough. Augmentin is a combination of 2 antibiotics, and this 2 dose of antibiotic is enough. But if you go with the code and all, I don't prefer to do that. My process, I don't make things complicated. I make only things simple. मेरे को सिंपल चाय पसंद है. और तुम्हारी मसाला चाय और उसमें अदरक मसाला मिर्ची and then baba radu. I don't like masala tea. I like simple tea. Simple orthodox green tea. Put 2-3 leaves in boiled water and then drink that tea. Your mind is refreshed. I don't want to drink your milk and sarbat, putting lot of white sugar, then adrak, then ginger, then kapoor, then long, ayo rama. That is not a tea. It is called what? A drink. It's a mocktail. I call your tea as a mocktail, and I call my tea. The way of making tea is very simple. Take a boiling water, put few leaves of orthodox tea or green tea, close it, after some time open it and drink it. You'll really find yourself refreshing. But if you take this white sugar tea, it's very dangerous for you. Am I right?
But after stem cells, the patient should be immovable.
Patient should be?
Immovable.
No, it is not like that, madam. In Parkinson's, patients are movable.
In allopathy, like some people they inject.
Where it is written? I have written a book. I have written a book on stem cell therapy. I have not written it as a immovable patient only should be given stem cell therapy.
No. After injection, like stem cell therapy, patient should not move that part.
Nothing like that. We take out the stem cell therapy. We allow the patient to go home after 30-40 minutes. Where it is written? No complication has been found like this.
Because allopathy people they follow, some people they follow.
We are allopathic only. We are not homeopathic, right? The orthopedic plastic surgeon, the neurosurgeons, all these are allopathic only who are doing it.
Yeah.
Sir, how many sessions of
This is the allopathic
stem cell
hospital. This is the allopathic hospital.
therapy?
Taking out bone marrow, it is about which kind of procedure do you adopt to take out the stem cells. If you do an aggressive procedure, that procedure is very difficult. But if you take a minimal procedure, it is an easy procedure. It's up to you what kind of procedure do you adopt in taking out the stem cells.
Okay. Right.
अगर किसी चीज को कॉम्प्लिकेटेड करते हो तो उसका कोई उपाय नहीं है, बट अगर आप सिंपल कर दो तो उसका सब उपाय है. If you
That's
make
what
a
it was not
position
first.
complicated, if you make the thing complicated and you make a high perspective charges and you create a new drama in it, the drama has no end. But if you
That
make
is
it
how it was
simple,
when
a simple
it
procedure,
started.
if you make it a simple procedure, I tell you, there is no complication. It's very cheap, simple, and easy procedure.
Hello, sir.
I have written a book on it, so I can say that. After reading many books, I found these chapters are missing. So I added a book. So you are always saying, in which book it is written? I said, okay, I write a book and I give it to you. In this book it is written. Read.
Hello, sir.
He always said there is no textbook of brain mapping. Okay, I wrote the book of brain mapping. Now read. Every day I give you notes. Read. Every day I give you slides. Read.
Sir, one doubt. The plat plat platelet injection is for platelet injection, or bone marrow is more fast
See,
regeneration.
see, bone marrow is crorepati. Is a billionaire.
Acha, acha,
And platelet is lakpati. Is a millionaire. So you must decide you want to work with a millionaire or a billionaire. Right? What the stem cell properties? But now what is feasible for you? Millionaire or billionaire? It depends from case to case. What is your approach? You want to go with millionaire or you want to go with a billionaire? So it is like sharks. In every movie you see, there's a, I think in US, Singapore, there is a very famous show going on. Sharks. Seven sharks, right? Right? So you wanted to partnership with whom? The millionaire or billionaire? It's up to you.
Sir, how many sessions of stem cell therapy is performed?
We have performed 16, 18, 20. Every week we perform one.
And
Till
sir,
the patient is with us, continue performing stem cell.
and,
So from one side we take 1 week, other side we take other week. Because we take only 10 ml of the bone marrow, right? We cannot take out more than 10 ml. It is very difficult to take out more than 10 ml. So if some people are saying we can take out 60 ml, Radu, it is not possible. We have tried our level best.
and
From this
sir,
procedure, we can take out only 10 ml of bone marrow.
okay. And sir, does growth hormone has any role to play with this?
But it is a cell, right? Wherever it will go, it will promote. These are promoters. Power Baba. Stem cell means what? These cells goes to that area and it proliferates.
Yes, sir, that I
Means
got.
Ma 2 becomes 4, 4 becomes 16, 16 becomes 32, 32 becomes 64, 64 becomes 124, 124 into 124, 124 ka double, double, ka double, double, ka double. It becomes geometric progression.
Geometrical proportion, it will go.
Yeah, it will go into geometric progression,
Yeah.
not arithmetic progression. It start with arithmetic progression, but it goes to geometric progression. So millions of cells can be created in your body, but millions have to be injected of cells, various areas of the body.
May I ask a question, sir?
Tell me.
Sir, in case of diabetes, you're going through the bone to the bone marrow. So, what is the time for recovery of the incision that you have done?
3 minutes.
That's all.
Yeah, 1, 2, 3. Less than 2 minutes, you have the stem cell in your hands.
And, and it is under local anesthesia, sir?
Local anesthesia, lidocaine.
Uh-huh.
Why to make a thing complicated? Then making it simple. Today I have to convey a sad news. One of our colleague, Mr. Sach's father, he was supposed to come to this hospital today, and yesterday at midnight at 1:45, 1:15, he lost his father. We pray, Bismillahirrahmanirrahim, so that his father gets peace in heaven. May God grant peace to his father's soul. And it is really very devastating and astonishing that a good man, has lost his life. May God grant peace to his soul and give a peace to his life. We all, from the class side, we pay our tributes and condolences on behalf of each one of you to the father of Sachin Pawar. Because Sachin was supposed to be with me today, but midnight his father expired. And this cremation took place today. And I really feel sad about all this. But life and death is always in the hand of God. We are just what? The witnessers. And we always pray that the departed soul be raised in peace. And we as the members of this fellowship class, we forward our deep condolences to Dr. Sachin Pawar and his family. May the departed soul rest in peace, and may they give enough strength from the Holy Father so that they can regain their uh, faith, and they can solace their soul, and they can come up with a new spirit in a new way where the departed soul can be. They can feel the it is a irreparable loss. Losing a father is irreparable loss. I tell you, because I lost both my father, mother. The moment you lose your father, suddenly you become 50 years, and suddenly you become 60 years. After losing my father, I suddenly became 70-year-old man. So when after your father is there, whatever age he is, you enjoy your youth. Moment the father dies, you become an old man. In Hindi, it is said, "पिता मरने से छत गई, माँ मरने से घर गया." When your father dies, you lose your terrace of the house. But when the mother dies, you lose the whole family. And that is practical with me. So we all pray for the peaceful departed soul. भगवान आपकी आत्मा को शांति दे. और any more questions?
Sir, yeah, treatment, one treatment, how much charges? How much charges, sir, for one treatment of stem cells?
No, one is not enough, Baba. One is not enough. बकवास है. ये जो कर रही है, it is बकवास. According to me, it needs multiple treatments.
But what is called cost for the one treatment?
हाँ?
Cost क्या होती है सर? मतलब एक बार की मतलब
ये डिपेंड करता है आपको कौन सा तरह का स्टेम सेल चाहिए. 2 मिलियन 12 मिलियन चाहिए या 5 मिलियन चाहिए. हमारे यहाँ तो ये डिपेंड करता है. 12,000 से 15,000 20,000 रुपये थेरेपी का जाता है.
एक थेरेपी.
हाँ, यस. क्योंकि नीडल का कॉस्ट ही आपका बहुत ज्यादा आ जाता है. बोन मेरो स्टेम सेल नीडल कॉस्ट यू अराउंड 6,000 to 10,000 rupees. Then orthopedic charges and the developing charges. So disposal and all cost around 20,000 rupees. So today is not very good day because we lost one family member of our family, and I like to close this class with very deep condolences, sadness in our heart that we lost a member of family. We do not know who is Sachin Pau. Whoever is in our class is a family member. And today, I was not in the mood of taking the class, but then it is our duty. Woods are lovely, dark and deep, and yet the promises to be kept. And miles to go before I sleep, and miles to go before I sleep. अभी मिलो पैदल चलना है सोने से पहले. Every day, when my mother died, I also said the same thing. I have to work till I die. And I'm very happy that he tried his level best. Even up to his last moment, he tried. And I really rejoice that part that you tried your level best. Rest, God will do the rest. And neither you. See, always remember one thing. I tell you one small experience of my life. Never judge yourself with results. Remember, never judge yourself with results. Please hear me. Please hear me. Mute your mic, everyone. Never judge yourself with results. For different circumstances in your life may lead to different results. But yet, if you, in your hard times, do not give up, then neither you nor he, the Heavenly Father, both of you. It is always remember your name should be written in his book, not in the book of the society and in the book of the public. I always feel don't think about the results. All the circumstances may lead results. What we expect and what we get is different. But yes, may things happen in His grace and may His glory. Vasudev Sutam Devam Kans Chadu Vardhanam Devki Nandam Parma Vande Krishna Vande Jagat Guru. May the departed soul get peace in His name. May the Christ bring Allah forgive all his sins and may he take him to his holy kingdom with happiness. Rejoice. May his all sins be forgiven. We pray that let things happen in his mercy, in his glory, in his peace, and led by the judgment of the God. What he said. In Bible it was said, a beautiful sentence. When Jesus Christ was asked, he said, when I have 100 sheep, right? And one goes missing, the shepherd of the sheep will find one sheep and will bring it with the 99. And then he says, and he finds happiness, right? So Jesus said a very beautiful sentence. I'm happy with my 100 sheep. Even one goes missing, I'll find that one. And that is why he called, is the shepherd of the sheep. And that is why it is said, Vasudev Sutam Devam Kanscharu Vardhanam Devki Nandam Parma Vande Krishnam Vande Jagat. So the Guru which is inside you, the soul which is inside you, is immortal. May the immortal soul find its way to the glory heaven. And I tell you, I have 7 death experiences. I was 7 times on ventilator. And I tell you, the life on the other side is more beautiful than the life on the earth. This is my personal experience. Because you can see my lecture with Dr. Mohammad Reza Abbasi. He's a renowned legendary neurosurgeon. He took one of my interview. What is my near-death experience? And then I said, my near-death experience was so beautiful that I feel every 1 month I should have a heart attack. And I should man, I should see that I go to ventilator every month, but the patients will suffer. So every 3 months I should have one ventilator say, go, take rest, and I call it honeymoon period of my life. Right? So with this, we conclude. You may ask your questions tomorrow. We are very happy. And it's my humble request to Walid, please put up the recordings. We pray to God for we pray to God for the uh, strength to Dr. Pawar's family, to his wife, to his children, to him, for whatever he has lost, whatever he has suffered. May strength comes to him. May he come out from that sorrow, and may God give him peace, prosperity, and eagerness. May Lord bring him peace in his mind, his heart, and grave. May peace be with him, his family, and child. Om Shanti 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 Tyo Shanti Prithvi Shanti Sadapaya Shanti Vishwavedaha Shanti Brahma Shanti Sarvagam Shanti Shanti Deva Shanti Shama Shanti Redi Om Shanti Shanti Shanti. With this, I take my farewell from the class. Thank you, Dr. Luke. ओम मानी पामे हूँ ओम नमो बुद्धाय नमो मणि पामे हूँ ओम मामी पामे हूँ ओम मामी पामे हूँ ओम अमितापा 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 अमितापा. Let Buddha give him Bodhisattva. Let the peace be there. Let tranquility be there in everyone's mind. Happiness be there. Both to this world and the other world. May everyone be happy. Everyone be strengthen everyone. We have wisdom. Vidya vinati vinadati patratam dhanatapitam dhanatharmo tathosukam. That which knowledge gives you wisdom, wisdom gives you skill, skill gives you money, money gives you, and if the money is used for the right purpose in the right way, it gives you happiness, and that is called the eternal happiness. The happiness which is inside you may flourish, may you grow, may you love, and may you live. This is what my feeling. Namo Harintanam, Namo Siddhanam, Namo Aryanam, Namo Ujjayanam, Namo Lohe Sarva Sahunam, Eso Panch Namo Karo, Sarva Papnashano, Manglaicham Satyam Si, Paramam Hoi Mangal. स्वामी समर्थ महाराज आपकी रक्षा करे। जय गुरु दत्ता, जय गुरु दत्ता, गुरु दत्ता, गुरु दत्ता, गुरु दत्ता, गुरु दत्ता। Amen. In the name of the Father, Son, and the Holy Spirit, may this soul be rest in the peace. Thank you so much, all of you.
Amen. Amen. Thank you
Amen.
so much, sir. Thank you.
Thank you, sir.
Thank you
Yeah.
so much, Guru. Terima kasih
Thank
banyak.
you.
Thank you, sir.
Thank you so much.
Thank you.
Kublai Sibon.
Thank you, sir.
Thank you, sir.
Kublai. Kublai
Thank you,
Sibon.
sir.
In Meghalaya, we got it Kublai. Thank you so much. And in Malaysia, we call it Terima kasih banyak. We call in Malaysia, we call it Terima kasih. Terima kasih banyak. Thank you.
Indonesia, Guru.
Terima kasih banyak. Terima kasih. Dr. Leo? Terima kasih.
Thank you.
Thank you so much for attending the class. We are really happy to see you with us. And today is not a good day for us because we lost a family member, but it is very good day that we all met together to be the part of the class and to express our sorrow and gratitude to Sachin Pawar Saab. In this moment, we all stand by him. Thank you so much. I hope this class. Om Shanti.
Thank you so much, sir.
Om Shanti. Ami Dhapa. Ami Dhapa. Ami Dhapa. Ami Dhapa. Ami Dhapa.